of my paper presentation is change in refractive error in pseudophakia and aphakia after cataract surgery in children's. Firstly, this research was purely for academic purpose. It does not carry any commercial value or financial interest. Let's start from the introduction. A congenital cataract is clouding of the natural lens at early childhood. It is one of the major treatable causes of blindness, and it is one of the major treatable causes of blindness, and 5 to 20% children are blind of it worldwide. In my research, I have observed two of the parameters of cataract surgery in pediatrics. That was pseudophakia with IOL implant and aphakia without IOL implant. Both of the cases are challenging because if you are going to left the patient aphakic, it's difficult at that age to handle the spectacles or contact lenses. While in pseudophakia, it's challenging to calculate the IOL power because it's difficult to understand the factors influencing growth of globe in children for their visual outcomes. After reading literature, to the best of my knowledge, it was not being researched in Pakistan. As I have conducted the study, after 3 months of follow-up, I have checked the refractive errors of pseudophakic and aphakic both, and I have also checked their best visual outcomes. Helmholtz reported that younger age of cataract surgery brings better outcomes, and Alde said that a specific IOL number for a specific age is better, and McAlde said that he developed a proper logarithmic formula for this purpose. The basic objective of my research was to assess the postoperative refractive changes in both pseudophakia and aphakia. The study design of my research was descriptive cross-sectional study, as the prevalence was assessed over a defined period of times, that was 3 months. And the sampling technique was non-probability sampling, as I didn't taken the sample randomly, and the formula used was Shapiro-Wilk test, that it was suitable for my sample size. At the sample size of my research was 32 patients. And the post-op refractive errors that was calculated by using the t-test. There were 32 eyes of the patients. 20 of those children were with bilateral cataract, and 12 of them with unilateral cataract. I have divided them in 2 different categories, that was pseudophakia and aphakia, and the 4 different groups based on their age. Pre and post detailed ocular examination was documented. And after that, we have received the results. Here you can see the mean, standard deviation, and standard error mean. Here, this was the refractive status after 3 months, and after best corrective visual acuity, we found that refractive error in pseudophakia was only minus 1.537, while in aphakia, it was minus 2.539. Here, this is the graphical presentation, and this is the box and whisker chart. Here you can see pseudophakia, it was falling between minus 1 and minus 1.50, while in aphakia, it was between minus 2 and minus 3. So we concluded that pseudophakic eyes show less postoperative myopic shift than aphakia, and this study, in my study, I conducted this follow-up after 3 months of the cataract surgery. Further, I will recommend to increase the sample size or long follow-up, like more than 3 months. It can bring different results. Thank you. Any queries? Thank you, sir.
Now I will request Aga Saad to come and present the correlation of the interpupillary distances with range of overvisions.
Bismillahirrahmanirrahim. Myself, Aga Saad Khan. I have done MPhil Optometry from King Abad Medical University. Currently, I am working as a consultant optometrist at Asif Hospital. Today, the topic of my discussion is correlation of interpupillary distance with range of convergence. Following are the contents of the presentation: introduction, objective, hypothesis, material and methodology, result, and finally the conclusions. Interpupillary distance is the horizontal separation between the centers of the both eyes, usually measured in millimeters when head looking straight at the infinity. The normal range of interpupillary distance is between 56 to 71 millimeters. When both eyes simultaneously move nasally in order to maintain the binocular single vision when looking at a close object is known as convergence. Before discussing the near point of convergence, let me discuss the RF ruler. RF ruler is a scientifically designed instrument to measure the near point of convergence. It has 50 centimeter long rod, the movable target. There are different type of targets, accommodative and non-accommodative. For the purpose of measuring near point of convergence, we have taken the non-accommodative target, that is a black spot on a line. Examiner told the individuals to focus on the black spot and move the target at the rate of 1 to 2 centimeter per second. And when the patient report diplopia, the point is noted, which is the near point of convergence. Near point of convergence, the normal range of near point of convergence is 6 to 10 centimeter. When the patient report diplopia before 10 centimeter, it is termed as convergence insufficiency. And when the patient report diplopia after 6 centimeter, that is for example 4 to 5, it is termed as convergence excess. The main objective is to find out the relationship between interpupillary distance and range of convergence. We hypothesize that people with large interpupillary distance have remote near point of convergence. We have taken the sample of 100 individuals. Both male and females are included in this study. The age group is between 18 to 30 years. Refractive status should be e-metropes, ocular health should be healthy, and data collection was performa based. We have taken e-metropes and the age between 18 to 30 young individuals, so that age and refractive error should not affect the near point of convergence and interpupillary distance, and so pure relationship between interpupillary distance and near point of convergence will be calculated. There are 42 males and 58 females were included in this study. The graph represents the number of individuals according to their age. Visual acuity was recorded on Snell visual acuity chart. Refractive status was confirmed on autorefractometer. Interpupillary distance was measured on pupillometer, and near point of convergence was noted on RAF ruler. There are different methods to measure the interpupillary distance, but the best method is to measure through pupillometer, which uses the cornea reflex of the individuals to measure the interpupillary distance and ranges between 47 to 84 millimeters. We categorize the strength of correlation as weak, moderate, and strong. The values between 0 to 0.3 was termed as weak, and values between 0.3 to 0.7 was termed as moderate, and after 0.7 to 1 was termed as strong correlation. When Pearson correlation was applied, the result showed that there is strong positive correlation between interpupillary distance and near point of convergence, with the correlation coefficient of 0.944, which is very strong correlation that I have discussed previous. With the increase of interpupillary distance, the near point of convergence was also increased. Correlation was significant at the level of 0.10. However, the age has poor correlation with IPD and near point of convergence. Table of correlation show that interpupillary distance and near point of convergence has a strong correlation of 0.944, which is very strong correlation, and the correlation between interpupillary distance and near point of convergence is weak, which is mentioned as 0.53 and 0.09 respectively. This graph represents the when the interpupillary distance of the individual increases, their near point of convergence also increases. This graph shows the strong positive correlation between interpupillary distance and near point of convergence. Interpupillary distance of the individual included in this study ranges from 54 to 75. The mean value of male IPD was mentioned, and the female also mentioned. The difference between the male and female IPD values were 2.15 with a standard deviation of 0.8 millimeters. Independent sample t-test show that this was not very significant with the p-value of 0.11. The near point of convergence of the individual included in this study ranges from 5 to 14 centimeter. The mean NPC of male and female was also mentioned. The difference between male and female IPD was shown that there is 1.4 with the standard deviation of 0.49 centimeter. The independent sample t-test showed that this difference between male and female NPC was very significant with the p-value of 0.003. This graph represents the mean values of near point of convergence and interpupillary distance between male and females. So if we summarize the result as there is strong positive correlation between interpupillary distance, that the people with large interpupillary distance will have remote near point of convergence. Males have remote near point of convergence as compared to females. So we concluded the study that NPC values of the people with larger interpupillary distance and male gender should be measured carefully to rule out the convergence insufficiency, and proper advice should be given for near activities. Any questions? Thank you.
Thank you, Saad. Very interesting presentation. Now I will request the Faisal Rashid to come and present the effect of changes in iris color on myopia. Effect of change in iris color on myopia.
It's an interesting topic.
Yes, sir.
So we will see the results.
Bismillahirrahmanirrahim. My name is Faisal Rashid and I am working as Senior Optometrist in Eye Unit 1 of Services Hospital, Lahore. So the topic of my presentation is effect of change in iris color on myopia. As we all know that myopia is one of the most prevalent and abundant cause of treatable blindness worldwide, and it is growing so much that the half of the population will be myopic by the year 2050. So the burden is increasing day by day. We all know that there are many factors contributing towards the myopia, and most of them are we consider as external factors like screen time and lack of outdoor activities and all that. But we thought that maybe there is something genetics in it involved, that the iris is one of the most important thing causing the genes to be mutated. So we tried to find out that if there is any correlation between the iris color and myopia. Study design was a multidisciplinary cross-sectional study, 9 months duration, and 300 individuals were enrolled. 198 were female and 112 were males. And we included the person from 11 to 25 years of age, and all were corrected to 6 by 6. One thing we included in this, that every person involved in the study was having screen time of 6 hours per day, so that we removed the external factors and concentrated on the genetic factor. All the subjects they were gone through the routine examination, and then we took the images of the iris in a darker room with the Android camera, so that we could get the best picture out of it. And after taking the pictures, we got the results, and then we graded them in from 1 to 5. This is the grading system, lighter being the grade 1 and grade 5 in the darkest iris. Of 300 subjects, there were 188 were females, and as I told, then we included mild, moderate, and severe type of myopia. And although most of the patients, because in our region, in Asian regions, most of the people were having darker color iris, that was between 3, 4, and 5 color iris. As we all know that, and the results were surprising, that the darker iris were more myopic refractive error, and it indicates that the patient with grade 5 iris color had a higher risk of becoming myopic. And this was the correlation results, that these were the females with severity of myopia, that 45 were mildly myopic and 40 were severely myopic and 27 were highly myopic and to the otherwise. And this was the degree of myopia with the lightest colored iris. We got that the 45 patients were having with the degree of mild myopia, and 41 were with moderate myopia, and 41 with the severe myopia. And it demonstrated that the 90% of the participants in the study had 3, 4 and 5 color iris. The vast majority of the patient had dark brown or medium brown eyes, with only 10% having light eyes. Suggested darker color iris and more myopic refractive error. According to the present study, patients with 5 grade iris color have higher risk of becoming myopic. And this was the severity with the iris grading. And we found out that in convergent myopia, dark brown was the most common iris color, while medium brown was the most common eye color in simple myopia. And we discovered that there was a link between iris color and refractive errors in people aged 11 to 25 years. And we found that there is a strong association between the color of the iris with the refractive error. It was also discussed by Meng et al. That he found the correlation between iris color and myopia, but his study was only in the lighter color iris people, and we did it in the darker color iris people as well. Darker color iris was linked to the higher myopic patients, and even when other non-risk factors were excluded, like screen time and outdoor activities, they were excluded. And we know that iris color distribution in young age can assist in early diagnosis, and pathophysiology behind that can be that due to the light absorption, as the darker color iris absorb more light, and that can lead to the development of myopia. This also adds there are 2 to 3 studies going on right now on the myopia. That one of them is called as atom study. Atom study is based on basically the atropinization of myopia control, that blocks the ciliary muscles and then allows the light to minimally enter the eye. That also supports this. And there is also a study going on that is also called as myopia and glaucoma in intraocular pressure, that they say that if we change the intraocular pressure, and then we can add that there is a lower risk of myopia. So we added to this study that there is association between iris color and myopia. And this is just the beginning, sir. We basically, I have just correlated with the Department of Genetics in Punjab University, and then to the Department of DNA molecular in the University of Faisal University, Islamabad. Now we are trying to find out that the genes causing the mutation of iris and the mutation of myopia and the mutation of RP, we're studying on that factors, so that we can find out is that there basically a link between, if we can change the genes mutation, can we reduce the myopia? That can be another leading cause of myopia control. These were the references of my studies, and thank you very much to all of you. Thank you, sir.
Very good, Faisal. And I think there is a lot of things to do on this topic. Now I request Rida Khalid. And Rida Khalid ni Ruma Farman or Sahibzada Hakim Anjam. He will be representing the adjustment to the disability and person with acquired visual impairment.
Why are these absent?
Bismillahirrahmanirrahim. My name is Hakim Anjum Nadeem, and I am presenting adjustment to disability in
ये जरा
persons
notes कर लें जो
in persons with acquired visual impairment. Should I take visual impairment that comes from errors of refraction associated with the eye and neurological pathologies is called non-correctable impairment vision. The WHO evaluated that about 161 million individuals worldwide had visual impairment, which occurs as a result of ocular pathologies, that is cataract, glaucoma, and degeneration of macula. Further, 153 million individuals had visual impairment due to non-correctable errors of refraction. Increased level of impairment vision is related mostly to the symptoms of depression, and decreases the contentment with life. The visual impairment can result in occupational deterioration. Therefore, patients are unable to perform daily life activities. It influences the people capacity to do tasks important for physical maintenance, mobility, and orientation. Therefore, patients require help from other persons. My objective was to assess the level of adjustment, attitude, self efficiency, and self esteem in persons with acquired visual impairment. Material and methods study design was descriptive cross-sectional study, and study was done in King Edward Medical University. Sampling technique was non-probability purposive convenient sampling technique. Sample size was 35 patients. Inclusion and exclusion criteria, we included the patients with the visual acuity less than 618 to PL positive, perception of light from 20 to 60 years of age, of any gender, patients having any acquired irreversible vision loss. We excluded patient having better vision than 618, patient not fulfilling the criteria of low vision. Patients had a cognitive impairment such as that they could not respond to the items in the scales. Patients had a history of any comorbidity condition except that which related to vision loss, psychological disorders of or of taking long-term psychiatric medication. Data was collected by self-designed performer. Adjustment was measured by acceptance and self-worth adjustment scale, uh, which is derived by the Dr. Daryl uh, Tabbert and Dr. Latham from 55 items, and we reduce in another scale they reduced items from 55 to 20 items. That was the epidemiological study depression scale, which published by the Lenoir Rudolph, the CESD, has 20 items which assess the level of depression during the past week. All data was entered and analyzed using statistical software SPSS version 20. Results. Factors affecting adjustment. Uh, Factors that should affect adjustment, and none of them were found to significantly uh, enhance or prevent adjustment to visual disability in our patients. The most common individuals resulting in blindness, corneal is related to cornea, corneal dystrophy, corneal degeneration, and corneal ectasia. This cross-sectional study found that some degree of adjustment had taken place in all our patients to their acquired vision loss. We found that all our patients had symptoms of depression, or at the very most felt distressed. By examining support network and the source of stress within it, and the predominant personality type of persons with the visual disability, we may be able to identify those at risk and refer them for family centered counseling, training them in how to best handle their emotions, and training family members to respond to the emotions needs of persons with the visual disability might contribute to reducing stress and depression. Thank you, sir.
Good. Uh, I will suggest, Kimanjam, we need to more prepare our topic. There were a lot of things which can be presented under this particular presentation, I think.
Sir, it reduces the all data like scales and other things to shorten the that was required to this forum, this
ठीक.
platform.
Thank you. Thank you.
Thank you, sir.
Now I will request Zarsha Rahman. She will be presenting awareness of patient dealing ethics among the optometrists of Pakistan. Awareness of patient dealing ethics. This is a very basic topic, and we need to learn these things and to tomorrow we have a separate session on the ethics. I will suggest we need to. It is a very interesting topic. We need to attend that topic also.
Hello everyone, I hope you guys are having great time here. I am Optoms Arsha Rahman, MPhil PGR, King Edward Medical University, Mayo Hospital, Lahore. So today I'm going to present a topic that I have done during my undergrad from College of Ophthalmology and Allied Vision Sciences. So basically when I was there in US doing my internship in Portsmouth Vision Center, Ohio, that's when I came to know that there is a hell difference between patient dealing ethics in US and then in Pakistan. So that's when I decided we should, emphasize this in Pakistan to improve our clinical conduct. So here is the topic: awareness of patient dealing ethics among optometrists of Pakistan. So what do you guys think about ethics? Basically, ethics is the branch of philosophy that deals with moral values. But in our clinical conduct or in our clinical setup, we usually call this term as methical ethics, in which we are concerned with obligations of doctors and hospital towards patients and other healthcare professionals, which is called collegiality, and the society members. So this is basically this is actually a broader term, but my concern was patient dealing ethics. Let me just tell you one thing, that these all pictures have been added after taking consent. So yeah, these are the basic pillars of medical ethics. You guys must be familiar with all these terms because we usually apply these ethical codes in our clinical practice. So autonomy, beneficence, non-maleficence, justice, confidentiality, informed consent, and we also add counseling in this part as well. So what do you guys think about this picture? Basically, this is actually a doctor which is very confused whether he should go to west or to east. The point of adding this picture was basically in our clinical practice we come across with such scenarios in which we are very confused whether we should prefer patient's autonomy or whether we should prefer patient beneficence. Let's suppose a patient came to you for a driving license, and also he doesn't want to wear glasses. So in such case, this is basically a challenge for you, whether you have to follow patient's autonomy or whether you have to follow patient's beneficence. So to tackle with such conditions, which is called ethical dilemma, one should have enough awareness of ethical codes to improve his or her clinical conduct. So this was the basic purpose of my presentation. So here comes the objective: to assess the perception of patient dealing ethics among optometrists of Pakistan and how they are being, they are applying ethical codes in their daily optometric practice. So here comes the methodology. It was basically a descriptive cross-sectional study with non-probability purposive sampling. Basically, I included 93 optometrists from all over Pakistan, and I have made a self-made online questionnaire performer in which I included different scenario-based questions, and data was automatically analyzed by Google form in the form of percentage graphs and frequency graphs. The study period was from September 2020 to December 2020. Basically, it was during COVID, so I had to do it online, everything. So yeah, the results came up. Out of 93 optometrists, 53 were females and 40 were males. So basically, the questions that I have asked during my in my online questionnaire performa, so these were all scenario-based questions, and then I categorized them that these questions are related to beneficence, and these questions are related to autonomy, and these are from informed consent. So results came up this way, that optometrists showed highest level of awareness in beneficence and non-maleficence, and then autonomy, and then confidentiality, and then counseling, fidelity, and justice. And these were the last, least respond. मतलब इसमें बहुत ज़्यादा poor response थे. Informed consent, sign language, and awareness of ethical codes. So these are the points where we should, work up. So this is basically the table showing percentages of my, the responses. And these are the questions. If you get some time at the end, then we will discuss this. So this is basically a frequency graph. You can see the blue color is showing the positive responses and the yellow one showing the negative responses. So you can predict that the study showed positive responses. So the conclusion of my study is study showed good awareness level of patient dealing ethics in majority of optometrists, except very few who showed who didn't know how to take informed consent from patients, and how to deal with patients hard of hearing with sign language. Basically, sign language is very underrated in Pakistan, and we should work up on this, because to improve inclusion in our society. So how we can improve such condition is for after arranging like guidance or awareness seminars under a proper ethical committee, so that we can improve our clinical conduct. So yeah, this is the take home message. Sometimes all you need is a perspective. Thank you. I hope you guys like my presentation. Thank you.
Han, please.
Yeah, this is the main challenge for all of us in government setups. But so basically, this is actually a fault. Okay, this is basically a fault at our end and from hospital faculty as well. So we both have to, tackle such situation. But the minimum you can do is, when a patient came to you, don't get angry to the patient. First of all, basically, तो ऐसा होना चाहिए कि you should, introduce yourself, and you should ask them that this is what I'm going to examine and everything else. But because we have a lot of patient in our OPD, so we can't do this thing. But the minimum you can do is just don't get angry to them. And the one thing that I have seen in our OPD is that we try to put trial frame on patient by ourselves. This is such an ethical conduct. We should ask patient to please put on the trial frame by yourself. So this is the minimum thing that we can do. But yeah. Okay. Thank you.
Now I request Hafiz Shabazz. He will be presenting on the low vision management of legally blind degenerative myopia to improve quality of life, a case study.
Assalamu alaikum. Nahmaduhu wa nusalli ala rasulil kareem. My name is Hafiz Shahbaz Anwar. I am working as optometrist in College of Ophthalmology and Allied Vision Sciences, May Hospital, Lahore. I am presenting a case study of low vision management of a legally blind degenerative myopia to improve the quality of life. According to World Health Organization, the definition of legal blindness is visual acuity of less than 360 or corresponding visual field of less than 10 degree from the point of fixation in the better eye with best possible correction. And the definition of low vision by WHO, a person with low vision is one who has impairment of visual functioning even after treatment, surgery or standard refractive correction, and has a visual acuity of less than 618 to light perception or a visual field of less than 10 degree from the point of fixation in the better eye, but who is potentially able to use vision for the planning and execution of tasks. Myopic degeneration is a condition characterized by the progressive expansion of the eyeball axial length, which is not stabilized during the adulthood, causing a progressive degeneration. These changes result in visual impairment, changes in contrast sensitivity, reduced dark adaptation, visual field changes, and electrophysiological changes. This causes extremely high amount of nearsightedness, causing a major alteration of the shape of the globe of the eye, which may lead to profound visual loss. The etiology of myopic degeneration is still not clear, but the influence of genetic and environmental factors has been increasingly recognized. This disease is a subtype of high myopia, which is characterized for refractive values higher than -6 diopters and axial length of greater than 26.5 millimeter. The prevalence of degenerative myopia is almost about 2% worldwide. Degenerative myopia is the seventh major cause of legal blindness. My case study is a 18 years old female named Nimra, resident of Jallopind, Lahore, referred to Low Vision Clinic of Mayo Hospital, Lahore on June 2018. After final diagnosis of degenerative myopia with high emotional, social, and economic repercussions. Her visual acuity was decreasing since 12 years back. She never used any glasses or any correction. She had no previous history of any other ocular pathology trauma in the past. She had no history of any systemic illness known to her and no similar history of visual loss in the other family members. In clinical findings, the anterior segment was within normal limits and dilated fundus examination showed posterior staphyloma. Her presenting visual acuity was 260 in right eye and 160 in left eye. Color vision was normal, contrast was reduced, and visual field on confrontation was markedly reduced. Her best corrected visual acuity was 360 with minus 26 dioptric spheres in right eye and 260 with minus 28 dioptric spheres in left eye. And her aided near visual acuity was N12 at 12 centimeter working distance. Finally, she was managed with a telescope, clip-on telescope of 6 magnification and a magnifier. It was a bar magnifier of 2 magnification. He was advised a gray filter to reduce photophobia. Training of orientation and mobility was imparted with counseling. In this case, counseling took a major place and had a vital role in the rehabilitation and promotion of self-esteem and resilience for this low vision person. Because at first she was never willing to use any type of low vision devices or even the spectacles. She and her parents were searching for a surgical management, but a good and continuous counseling made it easy for her. Results. In follow-up, her visual acuity showed a gradual improvement to 648 in the other eyes due to amblyopia recovery. She completed her matriculation after as she left the school in 4th grade due to poor vision. Later she married and doing all households and keepings very well and living a happy married life. Conclusion. Quality of life of a degenerative pathological myopic patient can be improved significantly by low vision devices and through a good counseling. Jazakallah khair.
Good. It is very interesting. Please have a seat. Regarding the myopic issue, I think Faisal will also elaborate this thing in detail. There are a lot of things which need to do, and a lot of work has been conducted under this optometry chapter. That how we can combat this challenge. Your topic also related to that. So now I will request Sabreen Manzoor. नहीं आई अभी तक. हाँ, और खतीजा तुफैल प्लीज़. फरीजा भी आई.
Assalamu alaikum everyone. Hope you are all are doing well. Bismillahirrahmanirrahim. Today my topic of discussion is prevalence of convergence insufficiency in 16 to 35 years old patients by using RAF rule. Convergence eye movements are the only visual response which causes our eyes to move in a disjugate manner in order to maintain binocular single vision. It has separated two subcategories which are convergence and divergence. Our eyes converge when we look at a near object, we focus while we do reading, and divergence, When we look farther away, our eyes diverge. So, what is convergence? Convergence is reduced eye movement in which both eyes rotate inward so that line of sight intersect in front of our eyes to maintain binocular single vision. Actually, our medial rectus contract so that our eyes can rotate inward and we can focus on a near object. Convergence insufficiency is a disorder of binocular vision characterized by the decreased ability to accurately converge the eyes to maintain binocular fusion while focusing on a near object, and last but not the least, the main factor, the receded near point of convergence, which causes problem later on. So the prevalence of convergence insufficiency according to a study is globally 5%, but there is a broad range of prevalence of convergence insufficiency which ranges from 2.5 to 33%. The main symptoms of convergence insufficiency are eye strain, which is also known as the ethanopic symptom. Main symptoms and the second main symptom is headache, and the rest of the symptoms are least common but not exophoria at near, blur vision, diplopia, and near vision reading problems. The objective of my study is to find out the prevalence of convergence insufficiency in 16 to 35 years old patients by using RAF rule in FMH College of Medicine and Dentistry, which is my undergraduate college. The purpose of this study was to assess convergence in all kind of the patient, whether they are symptomatic or non-symptomatic, uh, materials and method, inclusion criteria. All the subjects, the ages ranges from 16 to 35 years old, having best corrected visual acuity of 6 by 9 or better. Both male and female subjects and patients, those presented with the main complaints like headache, diplopia, and blur vision. Subjects that were below 16 and above 35 years having amblyopia or any kind of systemic diseases and having best corrected visual acuity of worse than 6 by 9 were excluded from my study. So the study design was cross-sectional observational study. So what was the operational definition for my study? All the patients having near point of convergence that were found to be greater than 10 centimeter will be considered to have convergence insufficiency. The normal range of the near point of convergence ranges from, according to different studies, some say that 6 to 8 centimeter, some say 6 to 10 centimeter. So I took 10 centimeter as the margin point to find out the convergence insufficiency. What was the methodology for my study? First, when the patient came into the OPD, I took the I took overall history and then came to the ocular history. I visual acuity both monocularly and binocularly, followed by the pinhole, AR, and then subjective refraction. Patient were rendered e-metropic after subjective refraction, and the NPC, near point of convergence, was measured using RAF rule. So here comes our RAF rule with which I measured near point of convergence. On the left side, it's nose rest, and on the right side um, is the place to hold that. So we can move that target. When patient report diplopia, this considered as the near point of convergence. The result, 33 patients had visual acuity of 6 by 6 with correction, and the rest of them were e-metropic without any kind of refraction. 34 patients presented with a complaint of headache, and only 30 patients were presented without any kind of headache. So 35 patients had normal near point of convergence, and 29 patients were found to have receded near point of convergence. So my conclusion was that out of these total 64 individual, 45.3% of individual were found to have convergence insufficiency, and 54.7% with normal near point of convergence. My reference study took 142 individual in total, 61 were male and 81 were female. Convergence insufficiency was noted in 27.5% of the population, and 53.84% of these were symptomatic as per the symptom survey questionnaire. And I studied 64 individuals out of 145.3% were found to have convergence insufficiency. So the results of my study is comparable with the reference study. Thank you, everyone.
Good, Khatija, very good topic. And one question here.
Yeah, yeah.
Can we, is there another method, some other method to measure the convergence efficiency?
Sir, there is a rough method to measure convergence insufficiency, which we can measure with a pencil or a centimeter scale. तो वो एक ज़रा that one is a rough method. This is the international method to measure near point of convergence. In that we can easily take the distance because there is a centimeter scale over it. That's why I took that one.
Very good. And to have a cheaper RAF rule, you can contact Mr. Hakim Anjum.
Yeah, sure, sir.
Otherwise, it is very expensive thing, but he has
Thank you so
locally
much.
prepared it. Very good. And I will request Dr. Tahsin Manju Saab to process this session further.
एक तो वाकई पिछले 10 सालों में हमारे सारे टॉपिक्स जो हैं वो कवर हो गए ऑप्टोमेट्री के। तो आज मैं वो जो देख रहा था टॉपिक्स तो काफ़ी मुश्किल थे और काफ़ी आपने मेहनत की है कि हम इसमें से कुछ ना कुछ रिज़ल्ट निकाल सकें। तो चलें, अप्रिशिएट करता हूँ मैं आप लोगों को। हाफिज़ साहब ने जो केस किया था वो 4 साल पुराना, उसे जब प्रेजेंट करते हैं तो नया केस आपने 4 साल पुराना प्रेजेंट कर दिया।
रिकवरी हुई है तो उस
और एम्ब्लॉयपिया तो वो कहते हैं कि जी 15 एज तक जो होता है वो इम्प्रूव करता है। आपको तो ये केस ही 18 पे मिला है
जी सर,
फिर भी
कुछ
आपने महसूस किया है कि इसमें इम्प्रूवमेंट थी।
इम्प्रूवमेंट हुई है सर इसमें, तो इसलिए फिर मैंने इसको प्रेजेंट करने का सोचा है।
इसको हाँ बिल्कुल आप अलग से प्रेजेंट करें कि भाई ये जो है एम्ब्लॉयपिया जो है ये 15 वाली बात या 12 वाली बात नहीं है
जी सर,
कि इसके बाद भी इस पे इफेक्ट आता है
जी
कि
सर।
इम्प्रूवमेंट हो सकती है।
इम्प्रूवमेंट हो सकती है नेक्स्ट।
ठीक, बाकी वही टॉपिक काफ़ी
जी
ऐसे
सर,
हैं।
थैंक
आपने एक दूसरे से कोई क्वेश्चन
कोई आपके आपस के कुछ जो पहले ना कर सके हों। ये जो आयरस कलर का टॉपिक है, इसमें ना बहुत बड़ा सैंपल लेने की ज़रूरत है, बहुत बड़ा, हज़ारों में। और फिर हमें उसके अंदर पोर्शन निकालने की ज़रूरत है कि इस कलर के जो हैं वो कितने परसेंटेज है आयरस की, और फिर उस पर्टिकुलर आयरस के अंदर प्रेवलेंस देखें मायोपिया की, तो ज़्यादा हमें एक ऑब्जेक्टिव हमें रिजल्ट्स पता लगे।
सर मैंने ये बेसिकली सर मोर और लेस एक पायलट स्टडी टाइप की है। मैंने आपको बताया कि मैं अब डिपार्टमेंट ऑफ जेनेटिक्स और इस्लामाबाद में जो फैसल यूनिवर्सिटी है वहाँ पे ये इसको स्टार्ट किया कि हम उसको सर कोलैबोरेट करके हम जीन्स म्यूटेशन लेवल तक जाएंगे। उसको देखेंगे कि हम ये किस तरह इसको प्रूव कर सकते हैं कि क्या जो आयरस के अंदर जो कलर की म्यूटेशन होती है वही मायोपिया में म्यूटेशन है, वही आरपी में म्यूटेशन है या नहीं है। तो उस लेवल पे इंशाल्लाह सर मेरा आगे प्लान है इसको करने का।
कितनी
एथिक्स में आपने कंक्लूजन क्या निकाला है?
सर एथिक्स में बेसिकली ये चीज़ भी आती है ना कि हमारी कम्युनिटी में बहुत से ऐसे लोग हैं जो कि बेसिकली हार्ड ऑफ हेयरिंग हैं, तो हम सबको बेसिकली चाहिए कि हम लोग साइन लैंग्वेज हम सबको आनी चाहिए ताकि हम लोगों को उन पेशेंट्स को डील करना भी आना चाहिए। दिस इज़ ऑल्सो मे बी इंक्लूडेड इन एथिक्स।
नहीं ठीक है, सारी बातें सही है, मैंने पूछना था। ठीक है,
थैंक यू सर।
बहुत अच्छी बात है। और अभी मैं, क्योंकि सब लोग मेरे स्टूडेंट ही आप लोग, अभी जाहिर कमाल साहब पूछ रहे थे कि कितने यहाँ पे पार्टिसिपेंट बैठे हुए, मैंने उनको बताया कि कितने हैं। तो सबसे ज़्यादा स्टूडेंट्स तो आप लोगों के हैं। आप लोगों के स्टूडेंट्स अगर यहाँ पे ना आए तो मैं, और डॉक्टर साहब को पता है कि कितनी एफ़र्ट हम लोग पिछले 5 सालों से कर रहे हैं कि हम यहाँ पे स्पेस ऑक्यूपाई कर सकें। तो ये सारी चीज़ें नोट करते हैं अपने वहाँ से। अभी एक हम बंदा वहाँ से शक्ल देख के गया है कि कितने लोग हैं यहाँ पे, तो इट मैटर्स एंड दिस इज प्लेटफॉर्म टू प्रमोट द ऑप्टोमेट्री। इसको बहुत सीरियस लें कि वाई पीपल डोंट कम हेयर। यही तो यानी आप कल अपने प्रोफेशन के लिए बात करते हैं, लेकिन हम यहाँ पे आना मुनासिब नहीं समझते। तो यू मे नीड टू यानी वर्क ऑन इट इंडिविजुअली एंड कलेक्टिवली बोथ। नहीं, शील्ड भी मैं लोगों को कहता हूँ कि ये फर्स्ट सेकंड थर्ड होना इज़ नॉट इम्पॉर्टेंट, शील्ड होना नॉट इम्पॉर्टेंट, दिस इज़ फॉर योर कैरियर। तो दिस वाज माय ऑब्जर्वेशन। और हमारे आगा खान के बड़े सीनियर बंदा यहाँ पे बैठे हुए हैं। मैंने उनसे कहा सुबह कि आप यहाँ पे आएँ और ऑप्टोमीटर से मिलें। दे आर गोइंग टू स्टार्ट दी ऑप्टोमेट्री इन आगा खान कराची में। तो मैंने कहा आप आके देखें कि व्हाट इज़ देयर स्कोप एंड हाउ दे आर मूविंग फॉरवर्ड इन प्रोफेशन। तो आप राशिद साहब डिसाइड ना हो, अगला सेशन भी है। आई होप कि 11 बजे के सेशन में आपके ज़्यादा लोग होंगे। तो
सर सारे स्टूडेंट्स ने कहा भी नहीं है, बहुत ज़्यादा बच्चों को तो पता ही नहीं है, उन्हें कहा भी नहीं है। हमने तो जो बुलबुल